Polymyositis is an inflammatory muscle disease. Look at this picture, shows that muscle pain, MRI finding muscle inflammation, and electromyography to detect muscle abnormalities. A detail going on. Introduction. Polymyositis is a rare inflammatory muscle disease characterized by chronic muscle inflammation and progressive muscle weakness. It primarily affects adults, especially those aged 30 to 60, and is more common in females than males. This autoimmune condition can significantly impact quality of life, necessitating early diagnosis and comprehensive management. Etymology. The term polymyositis is derived from the Greek word poly, meaning many, myo meaning muscle, and it is meaning inflammation. Collectively describing a condition involving inflammation of multiple muscles. It is chronic autoimmune disease characterized by muscle weakness and inflammation, typically affecting the proximal muscles. Definition. Polymyositis is an idiopathic inflammatory myopathy characterized by symmetric proximal muscle weakness due to immune mediated damage to skeletal muscle fibers. It is one of the idiopathic inflammatory myopathies IIMs, a group of disorder affecting muscle tissue. Types. Polymyositis is generally classified into 1. Primary polymyositis occur independently without association with other diseases. 1. Overlap syndrome, polymyositis associated with other autoimmune disease such as systemic lupus erythematosus or scleroderma. 3. Cancer associated with polymyositis linked with malignancies. 4. Juvenile polymyositis rarely occurred in children. Causes. The exact cause of polymyositis is unknown, but it is believed to be autoimmune in origin. Possible triggers include 1. Genetic predisposition, 2. Viral infection, example HIV, 3. Environmental factors, exposure to certain drugs or toxins. Risk factors, 1 age commonly occur in adult between 30 to 60 years. 2 gender female are more frequently affected. 3 family history genetic predisposition to autoimmune disorder. 3 infections viral infections that trigger immune responses. 4 autoimmune disorder higher risk in individuals with other autoimmune disease. Complications 1 muscle atrophy. 2 respiratory failure due to diaphragmatic involvement. 3 dysphagia difficult swallowing. 4 cardiomyopathy or arrhythmias. 5 increased risk of malignancies. 6 chronic fatigue and decreased quality of life. Pathophysiology polymyositis involves immune mediated process where autoantibodies target skeletal muscles leading to 1 muscle fiber necrosis damage to muscle fibers. 2 inflammatory cell infiltration T cells and macrophages invade muscle tissue. 3 fibrosis and atrophy chronic inflammation causes muscles scarring and weakening. 4 cytokine release promotes inflammation and tissue damage. The pathophysiology of polymyositis step by step process. 1 autoimmune activation. 2 antigen presentation. 3 T cell inflammation. 4 inflammatory cascade. 5 muscle fiber necrosis. 6 fibrosis and atrophy. 7 loss of muscle strength. 8 systemic effects. In severe cases, systemic inflammation may involve other organs such as the lungs, causing intestinal lung disease or cardiac involvement. Signs and symptoms 1 symmetrical proximal muscle weakness, example shoulders and hips. 2 difficulty performing everyday task, example climbing stairs, lifting objects. 3 fatigue. 4 muscle pain or tenderness. 5 dysphagia. 6 low grade fever. 7 shortness of breath if respiratory muscles are affected. A diagnosis 1 clinical evaluation, history of progressive muscle weakness, physical examination. 2 laboratory test, elevated creatine kinase CK levels, autoantibodies, example anti-JV1. 3 electromyography detects muscle abnormalities. 4 muscle biopsy confirm diagnosis by showing inflammatory infiltrates and muscle fiber necrosis. 5 imaging MRI to detect muscle inflammation. Nursing diagnosis 1. Impaired physical mobility related to muscle weakness. 2. Activity intolerance related to fatigue and inflammation. 3. Risk for aspiration and related to dysphagia. 4. Chronic pain related to muscle inflammation. 5. Risk for impaired skin integrity related to immobility. Disease management. First, medical management. 1. Medications. A. Corticosteroids, prednisone to reduce inflammation. B. Immunosuppressants, methotrexate and azathioprine. C. Biological therapies, rituximab for refractory cases. 2. Physical therapy, improve muscle strength and mobility. 3. Nutritional support for patients with dysphagia. 4. Management of complications, addresses respiratory or cardiac involvement. Nursing management. 1. Monitor muscle strength and respiratory function. 2. Educate patients about medication adherence and side effects. 3. Encourage regular low impact exercise. 4. Assist with mobility and daily activities. 5. Provide emotional support to manage psychosocial impacts. Treatment options. 1. Pharmacological, corticosteroids and immunosuppressants, IV, immunoglobulin. 2. Non-pharmacological, physical and occupational therapy, speech therapy for dysphagia. 3. Surgical, rarely indicated, but procedure may address complications like severe dysphagia. Psychosocial medicine. Polymyositis can lead to significant emotional and social challenges. Supportive interventions include 1. Counseling for coping with chronic illness. 2. Support groups for patients and caregivers. 3. Addressing anxiety and depression with psychotherapy or medications. Prevention. Although polymyositis cannot be entirely prevented, the following measures may reduce risk or delay progression. 1. Early treatment of autoimmune diseases. 2. Avoidance of known triggers, example certain drugs or toxins. 3. Regular health checkups to monitor symptoms. In conclusion, polymyositis is a complex, debilitating condition requiring a multidisciplinary approach to manage symptoms and improve quality of life. Early diagnosis, individualized treatment plans, and ongoing support are essential for optimal patient outcomes. Thank you. Have a nice day.